One of the main reasons we have the mental health assistance program is to prevent the recidivism. It's to break that cycle of those familiar faces who present themselves to law enforcement and move them out of that cycle of continued involvement.
So it's important for adults, and this is mostly for 18 years old on up, for adults to have an option. And one of the things that we found was that, or many of the things that we found were related to just the lack of understanding of law enforcement and many other law enforcement related, prosecuting offices, public defenders, probation and parole, just a lot of misunderstanding about the mental health conditions and what this means and how that affects behavior and choices.
But we have individuals, when they get engaged with the police, they have housing issue, they have medication compliance issue, they have family issues, they have self-care issues, they have lack of food, lack of resources. Some of them did not see the doctor for years. I always believe law enforcement, they have a lot to do and they have a lot on them,
Hopefully they see in the community, and if they see the community and law enforcement and EMS and everybody else working together, they know that we're for them and not against them.
I work with officers who are daily in the community, who run across individuals who have mental health, substance abuse issues, other types of needs, and this program has and will continue to fill a lot of gaps if it's serving this community.
The goal is diversion, early jail diversion. So then that speaks to the fact that maybe some of this would make a difference, and isn't it worthwhile to try? We always say we're not a big program, but we're a mighty program, because the people that we have interacted with, the percentage, 9 out of 153 have returned to the legal system, but those others have not.
The mental health assistance program is able to come and talk to the CIT classes. We're able to bring individuals in who have been assisted by these classes. And oftentimes it's hard to get people who have been involved to physically come to the site. But it's important that the law enforcement officers and first responders connect the individual needs that they have, and not just being told, hey, this is a tool to use, but this is how it has changed someone's life. This is how someone's life has been saved through this program.
So suddenly they're in a position now where it kind of frees up law enforcement from having to worry about these individuals, and which of course law enforcement is pleased with, because they can go and do more community policing, the things they need to do. And we also get these folks linked in with services and resources that they need for their quality of life and their stability, and it becomes a win-win. And they have then the option of maintaining themselves in the program for anywhere from 1 to 2 years. And so they have services, they have natural supports, they have stronger relationships with family, they might have a better connection with a faith-based community. And all that together provides kind of that wraparound support that, again, for a lot of us, if we're involved with friends and church and family and that's just our natural lives. We don't think much about the fact that this is just what we do, and I don't think we strongly recognize as well as maybe we could educate people better to understand that all that together provides your stability. So the MHAP program is been super successful in lowering recidivism. It's been really successful in lowering symptoms. It's been really successful in getting people hooked up with resources.
The PQA program that works with it, they bring the peer support in with the mental health staff, and the PQA program is able to show the officers how they can take a situation literally from the hands of the officer and walk them through whatever their needs are with a peer support specialist, someone that understands, someone that has a counseling background, someone who has been there, done that at some level to connect with them. And we're blessed to have this resource here in Iredell County.
I believe the whole point of my position is to come into it from somebody with shared life experience. I'm 14 years in recovery from alcohol, and I'm in AA, and I wanted to give back. They do challenge me. On most occasions, they want to understand why I'm there in front of them and why I'm willing to help them in their lives. So once that's stated, then I get a chance to share some of my journey and what's brought me to where I am in my career and why I'm there in the first place. And that seems to alleviate any of the tensions that maybe were displayed as soon as we met each other. And then, like I said, there's a method to the madness, trying to build a rapport and move forward together.
The beauty of just a network with partners and all the other county organizations is it connects from the roadside with the EMS first responder on the scene all the way up the chain to partners, and then everything in between, which involves law enforcement, healthcare, hospitals, and there's a lot of stuff in between there that has to get connected. So without that funnel down from partners and all the other organizations, that connection's not necessarily made. So 'cause that leaves a lot of folks out on their own. So the goal here is just to keep a continuous line connected through everybody.
There's so many factors, and we know that when people are in a mental health crisis or when they're in a substance use disorder, when they're dealing with a crisis in their life, that so many times people keep seeing the same people time and time and time again.
And a lot of times what I see is that people utilize law enforcement like they would counseling to be settled, to feel settled in the community, to feel safer. And that is exactly why the program was started, because the goal of law enforcement is not to play that role and take that burden off of them, so that they have a partner in the community who they can refer to and prevent that from happening. And it's a win-win for everybody. It keeps folks out of the legal system, away from law enforcement, so law enforcement can do the job that they are hired to do. And people gain their self-respect, they get employment, they get on meds so that their thinking is clearer. So those are some of the reasons that it's important to maintain a program such as this.